Endometriosis is a chronic inflammatory gynecological disease that causes, among other things, intense pain in the lower abdomen. The World Health Organization says it can significantly impair one's quality of life by causing severe pain, fatigue, depression, anxiety, and sometimes infertility. Tonight, we bring you the story of a young girl's battle with endometriosis as she seeks treatment. Her message to the world after 6 years of excruciating pain and almost 10 hospital admissions is that painful periods are not normal.
No mountain too high.
With her captivating voice and her passion for singing,
Even when I'm weak, God, you help me up.
Nicole Bett's talent caught the attention of many. But her music and school have had to take a backseat for now.
Painful periods is not okay. It's not normal.
Nicole's journey with endometriosis began during her early teenage years. She is now 18 years old, and like many others, she has endured debilitating pain with no answers.
I started feeling the pain from endometriosis when I was like 13 when I started my periods. But even before that, I already had pain. So typical of endometriosis, you have a heavy flow, painful periods, or just pain, and it's not really, you can't really detect it. So honestly, generally, we never knew what exactly I had. We thought it was like irritable bowel syndrome, because it can cause you have maybe diarrhea, constipation, there's pain. It can go throughout your whole body, heavy flow, but I haven't really witnessed that one because I have light abdomen area. But it also didn't make sense because it used to go up to my chest.
No one seemed to understand what she was going through.
The doctors used to say that I'm pretending or I'm just trying to get out of school. They said that they see nothing through the MRI, CT scans, even X-rays, that they see nothing that should be causing me pain. And instead of like looking into it, they just assume that you're pretending, and why? Because you're a teenager.
After years of suffering from unexplained symptoms, Nicole was finally diagnosed with endometriosis.
Immense pains to the point my heart rate goes up, I lose oxygen. Before I used to play, go out with my friends, have fun, go to school. Ever since the endometriosis has been discovered, that I do have it, and it's actually gotten worse after the first surgery. Haven't really been going to school, haven't gotten the chance to go out with my friends at all. Sometimes I can't even leave the bed, and I get constant pains.
Since the diagnosis, it's been a challenging journey of strength and resilience.
Nicole take a very strong medication, so that one you have to have somebody who can help you. You have to have a doctor, or you have to have a nurse, for not just any nurse, for ICU, because you know the medicines used are a bit stronger. Now them, they know how to measure what to use to do the home care. You have to be with her throughout because of the oxygen. Like right now, the time she's stable, we put up to 1. So there's a time she's very severe, so you have to pump a lot of oxygen. So all that, even if there's somebody who is there, you have to teach them how to do it before the nurse comes. Because to keep a nurse here 24/7, it's very expensive. Because the time Nicole, she's in pain, she can't stay in that bed. She cries, she crumbles, she anashika kitanda and bite. And sometimes I see her videos, I just cry. I miss her. In fact, to tell you the truth, Lillian, I miss my daughter. I miss her so much. To see her just sitting on the bed, she can't do anything.
So most of the time, when we reach the hospital, they will do a few tests, MRI, at some point colonoscopy and all that. They treated it like a gastro problem. So they could tell us that, talk to this girl, maybe she has some psychiatric problem or something to do with a social problem at home. At the moment, we have to do home care. And in home care, that's what we requested after we realized that the costs at the hospitals were so high. And they were just managing pain. It's really hurting to see that somebody can take that long, 6 years of pain. Just imagine 6 years of pain. Does it have to take that long before you really get to know what somebody is suffering from?
Managing Nicole's condition has been an expensive affair for the family. There's a healthcare gap as insurance companies do not cover endometriosis. Gynecologists say endometriosis can cause the growth of endometrial-like tissue on other organs.
Best way of diagnosis is where you see the lesions by SEM, and this is usually through laparoscopy, where you see the lesions and you take the lesion, you take it for histology. The main treatment, because these tissues, they respond to estrogen, the main tissue response is to treat it with things which will stop that estrogen from affecting them. One of it is by giving progesterones, okay, which can be taken by mouth or by injection. And the other second thing is to stop them from ovulating. So you give some drugs which we call LRH analogs. And these ones, they stop you from menstruating because they stop you from ovulating, and when you don't ovulate, you will not menstruate. But we can only give this for a limited time, maybe 6 months. And if medicine doesn't work, because painkillers also you'll give because of the pain, but if this one doesn't work, you go to surgical, whereby you have to remove them surgically.
Nicole is now seeking the help of family and friends to seek treatment abroad.
I just want Nicole to come back to get well so that she can do what she likes to do best, to help her peers, especially young girls that she's very keen to help now that she has gone through this sickness.
I spoke to Jambi Koikai, an endo warrior who battled endometriosis for 19 years, was treated abroad and her condition managed.
In my case, when the disease spread all the way to my lungs, I was misdiagnosed with tuberculosis. I was on the verge of starting TB medication. It was a divine intervention that I met this lady named Cindy who introduced me to a gynecologist who properly diagnosed me with thoracic endometriosis after 19 years.
Living with this chronic and painful condition has affected the lives of many girls and women just like Nicole.
So I sought treatment in the US in a hospital called Center for Endometriosis Care in Atlanta, Georgia. And I think to me that was one of the most amazing seasons of my life, because for the first time in my entire life, I had a doctor believing me when I said I was in pain, and they didn't think I was mad. They didn't think I was seeking attention.
With quality healthcare, Nicole can live a quality life again.
I'd use 15 to probably 20 packets of pads a month, and sometimes even diapers. But I don't use that. It's not that extreme anymore. I don't get lung collapses anymore, and that was the most horrific and tragic part of it. I don't get lung collapses anymore. That was fixed. I got my quality of life back. I work out. I'm back on stage. Performing, traveling, and those are things I was really struggling to do.
1 in 10 women of reproductive age suffer from endometriosis worldwide. Normal periods should not be painful, and that's the story of Nicole Bett, and she's appealing to you to rally behind her, to support her cause so that she can seek medical treatment and get back to doing what she does best. You can follow me on my socials. I'll put all her details there. I'll let you know how you can help support this cause. Let's get Nicole Bett to the path of recovery.